Our next guest is Greg Rovner, Healy CEO, who has information about telemedicine. Welcome to the show, Greg. For viewers who might not be familiar with what telemedicine is, tell us about it. How does it work, and how important has this become, especially the past couple months?
Hi, Aubrey. Thanks so much for having me. So telemedicine, which is also known as telehealth, is the ability to connect with your doctor virtually using real-time two-way video conferencing. Now, I recently saw a survey of 3,000 health practices that show 85% are using telemedicine today as compared to only 6% prior to the pandemic. On the consumer side, internet searches for keywords telemedicine and telehealth have skyrocketed over 10,000% since March.
Wow.
And loosening regulations make it even easier for patients because now they can access specialty doctors that are too far away or in other states, because telemedicine effectively tears down limitations of brick and mortar offices and state lines.
So, hey, say you're feeling sick. What do? Do you just make an appointment to talk to someone via telemedicine? Or when do you know to use it?
This is a really important question. For major issues, it's important to seek medical attention immediately and in person, such as emergency room. However, 90% of everything else can be addressed using your phone or computer via telemedicine. This includes general consultations, mental health visits, follow-ups, or really any appointment that doesn't require a doctor to poke and prod you. By giving patients this ability, they can get guidance from a physician from the comfort of their own home, which of course helps to reduce the spread of the virus. It helps keep the frontline healthcare workers safe and helps to limit strain on the healthcare system. So people can offer or access these services by filling out a short form online. A digital intake on a website usually gets them into the ability to access a doctor via telemedicine. And for the pandemic, we're offering a risk assessment based on symptoms. For patients that may not have health insurance or may not have access to a doctor, they can go to our website and connect to a licensed physician and get guidance according to the CDC and local governments.
That's good to know because Healy is a platform for telehealth. Now, you mentioned some of the appointments you can make. Does that even include specialists?
So it does include specialists. Using Healy, people can connect to alternative medicine doctors. And these are doctors that are focused on identifying the root cause of people's ailments, and they're focused on using natural products and lifestyle changes as a first line of defense. Currently, there are over 500 licensed physicians on the Healy platform with a variety of specialties, including women's health, men's health, mental health, pain management, opiate replacement, and much more. And people can access all of the services and more information on our website, which is healy.health.
Now, when we talk about telehealth, this has been around, but like you said, it's kind of exploded because we've had shelter in place and people haven't been able to go to their normal appointments. So kind of been forced into it. I mean, I had a telehealth appointment. I actually kind of enjoyed it because it was really more just talking about my specific health concerns. But with all the stress of coping with COVID-19, financial worries, illnesses, and more people, they're now turning to telemedicine. What about when it comes to mental health counseling? Is that included?
Definitely. Mental health counseling is actually one of the perfect ways to get a doctor via telemedicine because it doesn't require, that poking and prodding. They're able to connect, they're able to see each other and hear each other. So it's actually the perfect way to connect. But looking at it from the doctor's perspective, doctors were at risk of losing substantial revenues from having to close their physical offices as part of sheltering in place. But the innovations of telemedicine have given them the ability to expand their reach and expand their patient pools. For example, doctors who have joined Healy are able to cut costs by deploying Healy software in their practice. This provides them a business in a box. And also, it supplements their incomes by giving them the ability to treat not only their own patients, but also the Healy patients that are coming through via telemedicine. And, I can't actually picture a world post-COVID-19, but one of the lasting effects of this pandemic will certainly be that telehealth is here to stay and that will only continue to expand and improve healthcare.
All right, Greg Rovner from Healy, thank you so much for joining us. I agree. I think, telemedicine is here to stay, and it's safe because there's no physical contact. Appreciate you being here.
This interview involves commercial content. The products and services featured appear as paid advertising.